D-safranine counterstain application. Timer starting. Correct answer is C. Acetone alcohol decolorization step. The acetone alcohol decolorizer is the key differentiating step. Gram-positive bacteria retain crystal violet iodine complex due to thick peptidoglycan. Gram-negative bacteria lose the dye because their thin peptidoglycan cannot retain it under decolorization. A patient has prolonged prothrombin time, PT, but a completely normal APTT. Which single clotting factor deficiency is the most likely explanation? A. Factor 8 antihemophilic factor. B. Factor 9 Christmas factor. C. Factor 7 proconvertin. D. Factor 11 plasma thromboplastin antecedent. Timer starting. Correct answer is C. Factor 7 proconvertin. Factor 7 is the only factor exclusive to the extrinsic pathway. Its deficiency prolongs PT only, leaving APTT normal. Factor 7 also has the shortest plasma half-life of approximately 4 to 6 hours among all clotting factors. The Bombay phenotype, O, is characterized by absence of which critical RBC antigens, making it the rarest and most dangerous blood group situation? A and B antigens only. B H antigen and therefore A and B antigens. C Rhd antigen only. D Lewis A and B antigens only. Timer starting. Correct answer is B H antigen and therefore A and B antigens. Bombay phenotype individuals are homozygous HH at the FUT1 gene and cannot produce H antigen. Since A and B antigens are built upon H antigen backbone, all three are absent. Their serum contains potent anti-H, anti-A, and anti-B antibodies. Which stain is considered the gold standard for identifying Helicobacter pylori organisms in gastric biopsy tissue sections for histological diagnosis? A. Hematoxylin and eosin H&E stain. B. Warthin, starry silver impregnation stain. C. Modified Guy-EMSA stain. D. Periodic acid Schiff-Pa stain. Timer starting. Correct answer is B. Warthin, starry silver impregnation stain. Warthin starry silver impregnation stain is the gold standard for H. pylori in tissue sections. Silver deposits on bacteria appear as dark brown-black organisms against golden-yellow background. It provides superior sensitivity and specificity over Guy-EMSA. Xanthochromia yellow discoloration in CSF found 2 or more hours after symptom onset is most specifically indicative of which serious condition? A. Acute bacterial meningitis. B. Traumatic lumbar puncture artifact. C. Subarachnoid hemorrhage SAH. D. Viral encephalitis. Timer starting. Correct answer is C. Subarachnoid hemorrhage SAH. Xanthochromia results from oxyhemoglobin and bilirubin from list RBCs and is virtually pathognomonic for subarachnoid hemorrhage when found 2 or more hours post-bleed. Traumatic TAP is differentiated by progressively clearing RBCs between tubes 1 and 4. Beta-2 microglobulin forms a noncovalent association with which molecule to constitute a functional MHC antigen-presenting structure on nucleated cells? A. MHC class II alpha chain. B. CD8 molecule on cytotoxic T cells. C. MHC class I heavy chain alpha chain. D. T cell receptor alpha beta heterodimer. Timer starting. Correct answer is C. MHC class I heavy chain alpha chain. Beta-2 microglobulin is the invariant light chain of MHC class I molecules. It stabilizes the alpha chain and peptide groove complex. Elevated serum beta-2 microglobulin is an important prognostic biomarker in multiple myeloma and lymphoma. In peripheral blood smears, Howell-Jolly bodies represent remnants of which nuclear material and are characteristically seen following which clinical condition? A. Ribosomal RNA remnants in iron deficiency anemia. B. Nuclear DNA fragments in post-splenectomy or functional asplenia. C. Denatured hemoglobin precipitates in G6PD deficiency. D. Mitochondrial fragments in megaloblastic anemia. Timer starting. Correct answer is B. Nuclear DNA fragments in post-splenectomy or functional asplenia. Howell-Jolly bodies are residual nuclear DNA fragments normally removed by splenic macrophages during erythrocyte maturation. Their presence indicates functional or anatomical asplenia seen after splenectomy or in sickle cell disease with autosplenectomy. Which formula correctly calculates the sensitivity true positive rate of a diagnostic test used in clinical laboratory medicine? ATP divided by TP plus FP positive predictive value. BTN divided by TN plus FP specificity. CTP divided by TP plus FN sensitivity. DTN divided by TN plus FN negative predictive value. Timer starting. Correct answer is CTP divided by TP plus FN sensitivity. Sensitivity equals TP divided by TP plus FN, the ability to correctly identify all diseased individuals. Mnemonic, SNN out means a sensitive test with negative result rules out disease. SPPN means a specific test with positive result rules in disease. On hemoglobin electrophoresis at alkaline pH 8.6 on cellulose acetate, which migration order from fastest to slowest anode to cathode is correct? A. HBA then HBF then HBS then HBA2 then HBC. B. HBA then HBF then HBC then HBS then HBA2. C. HBF then HBA then HBS then HBA2 then HBC. D. HBA then HBS then HBC then HBF then HBA2. Timer starting. Correct answer is A. HBA then HBF then HBS then HBA2 then HBC. At alkaline pH on cellulose acetate, HBA migrates fastest toward the anode, followed by HBF, then HBS, then HBA2, and HBC migrates slowest. HBC and HBA2 co-migrate at alkaline pH and are distinguished by acid electrophoresis at pH 6.2. An osmolar gap greater than 10 mosm per kilogram measured minus calculated osmolality strongly suggests the presence of which substance in plasma? A. Severe hypernatremia causing plasma hyperosmolality. B. Renal tubular acidosis type 1 distal RTA. C. Unmeasured osmoles such as methanol, ethylene glycol, or isopropanol. D. Syndrome of inappropriate ADH secretion SIAD. Timer starting. Correct answer is C. Unmeasured osmoles such as methanol, ethylene glycol, or isopropanol. Osmolar gap greater than 10 indicates unmeasured osmoles in plasma. Classically toxic alcohols, methanol, ethylene glycol, and isopropanol. Calculated osmolality equals 2 times sodium plus glucose divided by 18 plus bun divided by 2.8. In cold agglutinin syndrome, the pathological autoantibody is typically which immunoglobulin class and targets which specific RBC antigen system? A. IgG targeting Rh system E antigen. B. IgM targeting the I or I antigen system. C. IgA targeting ABOH antigen. D. IgE targeting KEL system antigen. Timer starting. Correct answer is B. IgM targeting the I or I antigen system. Cold agglutinins are characteristically IgM antibodies targeting the I antigen in adults or I antigen in neonates. They activate complement at cold temperatures of 4 degrees Celsius. Mycoplasma pneumoniae infection classically produces anti-I cold agglutinins. Thrombin factor IIA performs all of the following physiological coagulation functions except which single action? A. Converts fibrinogen to fibrin monomers. B. Activates factor 13 for fibrin cross-linking. C. Activates protein C via thrombomodulin complex. D. Directly activates tissue factor 3. Timer starting. Correct answer is D. Directly activates tissue factor 3. Thrombin does not activate tissue factor. Tissue factor is constitutively expressed on subendothelial cells and activated by direct exposure to blood after vascular injury. Thrombin's actual functions include fibrinogen to fibrin conversion, activating factors V, 8, 13, and protein C. Which specific CD marker combination definitively identifies a mature natural killer cell NK cell by flow cytometry immunophenotyping? A. CD3 positive CD19 positive CD56 negative B cell profile. B. CD3 negative CD16 positive CD56 positive NK cell profile. C. CD3 positive CD4 positive CD56 negative T helper cell. D. CD3 positive CD8 positive CD56 positive NKT cell. Timer starting. Correct answer is B. CD3 negative CD16 positive CD56 positive NK cell profile. NK cells are defined as CD3 negative no TCR CD3 complex CD16 positive mediating antibody-dependent cellular cytotoxicity, and CD56 positive, NCAM. They kill virus-infected and tumor cells without MHC restriction as part of innate immunity. The principle of the Westergren ESR method depends primarily on which physical phenomenon involving erythrocytes in the presence of inflammation. A. Increased osmotic fragility of the RBC membrane. B. Rouleau's formation promoted by elevated plasma fibrinogen and globulins. C. Direct increase in RBC surface electrostatic zeta potential charge. D. Decreased RBC deformability in chronic inflammatory states. Timer starting. Correct answer is B. Rouleau's formation promoted by elevated plasma fibrinogen and globulins. ESR measures RBC sedimentation rate. Elevated acute phase proteins fibrinogen and globulins reduce RBC surface negative charge or zeta potential, decreasing intercellular repulsion and promoting Rouleau's formation. Stacked RBCs have greater mass and settle faster than individual cells. Congratulations! You have completed all 15 hard MCQs of Pmlt Mcq Series. Subscribe to Pmlt online learning platform for daily MCQs and boost your competitive exam preparation.